Hello, you're on Talk 1260 KTRC. This is Dr. Daniel Ronel. You're listening to Western Medicine, a show about plastic surgery, the realities of plastic surgery. I'm here with my wife, Betsy Ronel.
So, all right, here I've got some questions for you. I have obviously lots of female friends, and a lot of them are under 50, some are under 40, most are in their early 40s. And their questions, I don't know if you call this twofold, but here's the question. One, I think I'm too young for a facelift, but I definitely notice my face is aging.
Right.
Two, I think I want a facelift, but right now I just don't want to part with my money because who knows what's happening. What are your answers?
Those are two good questions. All right, first let's address the, am I ready for a facelift?
Right.
In New York, where I trained, there was a philosophy of if you start early in your 40s, you sail into your 60s,
right,
looking fantastic and not really needing very much. And a facial aesthetic surgery, whether it be facelift or eyelids or something else, done relatively early, say in the mid-40s, doesn't require as much surgery. It doesn't require as much surgery.
In the camera because we are
taking
recording
this, yes,
for YouTube, and we'll let you know that address when it comes out.
Yes, fine. You can find that on our website.
Yes.
Anyway, so when you do a facelift in the 40s, it doesn't require as much surgery, and the recovery time is much faster.
Because you're younger, there's less stuff done.
Right. When you do a facelift in someone who's got a lot of wrinkles, I can't really make as big a change because it takes a lot of recovery time.
All right,
so that's the one thing. You know, a facelift can be done at any age, really. I do facelifts on people who are 60 and 70, but more and more people are coming in their late 40s.
Right, that's when my mother had her done. Sorry, Mom. She had hers done.
And she looks great.
Yeah,
She's
she looks
70
fantastic.
now.
She's over 70, and she looks like she's in her 60s.
Okay, so that's the one question. The next question you asked about is, in this economy, are people really ready to part with their money for a facelift?
Your answer is going to apply to both. My first question was, what do they do if they're not ready for a full facelift, a surgical facelift?
Right.
And what do you do in this economy if they're not ready to part with the money that it costs to take that a full facelift costs?
Right. So my answer is, you look at what can be done in the office.
Right.
Because if you don't have to pay for OR and anesthesia fees, you save thousands of dollars.
Yeah.
And there are many procedures that we can do in the office. There are non-surgical procedures.
You've done plenty on me.
Right.
Yeah.
And then there are some surgeries that I can do in the office. The non-surgical procedures are basically Botox and fillers. A filler is sort of something that's injected into the face to plump it up, to lift the fat where it was before, to erase wrinkles. When you talk about aesthetic surgery or injecting fillers, it's not about putting stuff where it wasn't before. It's about restoring the anatomy. So as we get older, the fat droops down, and what the surgeon does is it restores the fat back upwards where it was before, and that's what's youthful. So for example, when I do a liquid lift, a liquid facelift, which is basically lifting the face with fillers, I inject it in such a way so that the fat pads which have drooped down come back up and make sort of a rounded apple cheek, or the fat pads that are causing a jowl are lifted back up. And that's really...
Where do you inject that? On the cheekbone?
The typical place to put it is on the cheekbone, a little bit to the side of the cheekbone.
Yeah, right here.
And also in the what's called the marionette line,
Right.
which is the line between the angle of the mouth and the jaw. And then also...
The nasos, right.
Okay,
Those
right.
are the big ones.
Right. The most common place to have it done is called the nasolabial fold, which is just that fold in between your nose and the corner of your mouth.
Some people call them the parentheses.
Yeah, the parentheses. And those, are very commonly filled.
Yeah.
So that's one way to do it. It's called a liquid facelift, and if you're not too wrinkled, then you're a candidate for that. Then we move on to Botox, which can help with frown lines and crow's feet around the eye. The next big step is to do office procedures, office surgeries.
Like
and what I can do in the office is eyelid tucks and brow lifts. And those are extremely rejuvenating.
I want a brow lift.
Okay. And It's an outpatient procedure. The patient's awake. I don't even have to give sedation, although I
How
can.
do you keep the pain away from the areas?
It's with a local anesthetic. It's like taking a mole off an eyelid or something. It's just, we've done so many of them that I realized how quickly and easily it can be done. And I just took it out of the operating room. There's no reason to pay
Well, that saves a lot
for
of money.
OR. Right. Now, there are people, of course, who do want to be knocked out.
I would want to be knocked out, but that's me.
And that's their choice. And then, of course, we can do that in the OR and anesthesia, and it costs more. But, you know,
It's your personal choice.
to do that sort of rejuvenation, you know, brow, eyes, it's about half of the cost of a full facelift.
It's much quicker too, because you don't have to wait for the anesthesia to kick in. It's much less dramatic to do it in
It's
the
less
office.
dramatic. The results aren't the same as the gold standard full face. There's nothing more powerful than that.
But when you're trying to stave off aging, and when you're not either emotionally ready or physically ready for a full facelift, these are great alternatives.
No, exactly. And
these are ways of sustaining your youth.
the recovery time is also much less. So people who need to get back into the workplace, a realtor, for example, or
Actress.
a television announcer or an actress, right? They'll have a much quicker recovery time with a smaller procedure.
So how bad is the swelling? And I mean, I know my experience, but in general, how bad is the swelling
It
and
really
bruising
depends.
from the liquid facelift and stuff like
It
that?
really depends. There's some people who don't bruise at all. I'd say on average most people bruise a little bit for a day or two, but there are some people who bruise a lot. Now what I do to try to avoid that is I have my whole integrative team,
Right.
you know, the non-traditional types of medicine. So we give homeopathic herbs and do treatments to help decrease the bruising and swelling in the face.
I mean, can I tell you about my personal experience, as you know? Just
Yes,
really
you
quick.
can.
My face, I had the cheekbones done, and my face really, the cheek area really swelled up, and I looked like the Wildenstein, Jocelyn Wildenstein in New York, the Catwoman, the famous Catwoman with those extra inflated cheeks. She wants to look that way, and she looks fine. That's her choice. But I wasn't comfortable looking like that, so I felt very swollen, and I stayed inside for about 4 days, 3 to 4 days, I would say.
It would
So.
not go out. I had to take the kids to school.
Right. I mean, just because I was uncomfortable, and I didn't really bruise. I had a little bit of yellowing of the skin, but I was very swollen, and that's my experience. I'm sure there are other people who have the same thing. So what I recommend to anyone who asks, if you don't know how your swelling goes, do it on a Thursday or a Friday, so you have the whole weekend and possibly Monday to take off as well.
Right, absolutely.
Yeah.
You're listening to Talk 1260 KTRC. This is Dr. Dana Ronel. I'm a board-certified plastic surgeon, and you're listening to Western Medicine, a show about the realities of plastic surgery. Stick around, we'll be back in a few minutes.